Welcome to Share the Health, a new podcast from the Ross County Health District, where we discuss health issues that affect our community. I'm your host, Sarah Smith. Today I'm joined by Ross County Health District Organizational Development Specialist, Michelle Long. Welcome, Michelle.
Good morning, Sarah, and thank you for this opportunity.
Yes, thank you so much for taking the time to chat with us today. At the Health District, we know you've been here for a while, so can you tell our listeners how long you've been with the Health District?
Yeah, I've worked for the Ross County Health District in the Public Health Nursing Division for over 28 years.
Lots of expertise. Were you in public health prior to working with the Health District?
I started nursing school a little later in life. And while I was in nursing school, I immediately knew that I enjoyed teaching, the teaching aspect of nursing. I also loved children of all ages. I graduated from associate degree nursing program in July and was hired by the health district in November to work as a school nurse in 2 local school districts. And this was before schools hired their own school nurses. So we served as school nurses at that time. But I quickly learned that public health concentrated more on the community or a population of people more than the individual. So 15 years later, I went back and got my bachelor's degree and gained all the additional knowledge that I needed around the community, the data, the research, social determinants of health, and all the tools that I needed to be successful in my public health nursing role, especially my favorite part, the grant writing aspect. So I think that's how I got started in public health. Really didn't know a lot about it at the time, but once I got in it, knew that I loved it.
Were there certain aspects, you'd mentioned public health focusing more on the health of the community rather than the individual. Were there certain aspects of focusing more on the individual that you were drawn to at the beginning?
Yeah, I think, I wanted to be a labor and delivery nurse. I think a lot of nurses go in, see something from the outside or have friends that do something, and that kind of guides, oh, okay, I would like to do that. Again, I did this later in life, so I had, been through having children of my own, et cetera. But then once I got into public health and took that position pretty close or pretty new out of school, I knew then that this was probably the direction where I would be going with my career.
So what are some of the programs that you've been involved with at the Health District in the past?
Oh my, I've been involved in a lot of programs. In fact, I have served in all roles in the Division of Public Health, and including some roles that are not in the division at this time, but the school nurse role, I've done infectious disease surveillance and investigation, including a pretty large TB clinic that we had. Again, and I'm speaking across 28 years, so a lot has changed. The Children with Medical Handicaps program, which is now complex medical help, emergency preparedness. I have done teen pregnancy prevention in the nurse clinic, which now is immunizations, TB, skin testing, that type of thing. Used to be a very large need before there were a lot of specialty clinics throughout our community. So in the nurse clinic, we treated head lice. We did sexually transmitted disease testing and treatment. We offered women's health services like birth control, breast and pelvic exams, prenatal care, ADHD care for children who had ADHD. And it certainly looks very different from 20 plus years ago. Eventually, after doing all the programs in the division, I was promoted to the assistant director of nursing, where I served for 11 years. And basically, in that role, I was kind of front facing to the community, attending a lot of meetings, gathering information, just trying to assure that what we were doing at the health district was the need at the time. And again, that all looks different from 20 years ago. But then in my last 6 years, I served as the director of nursing. But I can say in that role that grant writing has probably been my favorite role throughout my entire career. And that has been pretty much in every position that I served, I had a grant. Either that grant was fully covering my position or that grant was supplementing and I was doing some side work. If I looked back at my career of the 28 years, I've probably authored, co-authored, or was the principal investigator on probably 6.5 million grant dollars that have benefited the community. That's pretty substantial.
That's a lot of grants. So you mentioned a lot of programs that we don't currently have anymore over the last 28 years that you said that you've been here. So as far as the shift of programs offered, has a lot of that come down to just funding changes and the availability of grants, or are there other things that factor into those as well?
And I think we're going to get into some of those conversations as you and I go through this podcast. But I think if I was speaking from years ago, a lot of public health funding, because we don't get much, was centered around, we needed the funds. So we would write grants to be able to fund a position. And some of the positions, such as in public health nursing, some of those positions are mandated, state mandated. They're in the High Revised Code. And those are things we have to do, like infectious disease, TB, those type of things. So not having a lot of funding, so therefore putting someone in position and also giving them a grant to do. I think now we're wiser. We don't really chase the money, maybe what I would call that 20 years ago, but we try to align our work with the needs of the community. And some of those needs are same as national needs. Some of those needs are just community needs, smaller needs in the community. So I think that's where we're at now, where we're aligning those needs with our community health assessment, community health improvement plan, and all those things, which I think we're going to get into. But I think that is kind of, where we're at now. So our work is more focused. It's more, driven to the needs of the community.
So aside from the grant writing, was there a certain program that felt the most rewarding to you working with in the last 28 years that you've been with the health district?
Yeah, that was a hard one to think about because the entire career has been very rewarding. No matter what position I was in, it was always the right season. I always got great reward from helping people, helping the community, seeing programs succeed and make a huge change. But I would say in 2004, I wrote a federal grant seeking funds for a school-based program to promote sexual abstinence among adolescents in Southeast Ohio. And the grant was funded for $2.4 million, which was substantial, an substantial amount 20 plus years ago. And I do believe it is still one of the largest sums of money received through a one-time grant at the health district. The grant provided employment for nurses and teachers. We covered 9 counties and 41 school districts. And it was a huge responsibility. And I was much younger, of course. But over the 3-year period, the rates of teen pregnancy and sexually transmitted diseases decreased among school-age children. And I believe it would still be impactful today, as teen pregnancy and STDs are still a topic of concern. And I know that a lot of times sexual abstinence is not, where what they want to promote in the community, but it really made an impact. In fact, some of the folks that I had were in school, they're 40 years old now, and they see me in the grocery store and they still remember who I was and, what we talked about and the things that we did in that class. And it was a week-long class that we taught in grades 6 through 12. And I believe it made a huge impact in our community, seeing those rates go down and now seeing those rates are back up.
Now, was this the same program that would require students to take a baby doll home that would cry that they would have to feed? Is that the same program? Was that a different
Yes.
program?
So throughout the program, we had a variety of lessons on, it was character building. It was all of those things. A lot of the lessons that we did talking about sexually transmitted diseases and being real, letting them know what could really happen. And then at the end of the class, they would take home the baby for the weekend. And that was just an opportunity for them to see what it would really be like. I mean, the babies were very realistic. They cried and had a little key and they had to hold a bottle up to their mouth, for feeding. And they were very realistic. Again, that was in 2004. So a little different than today, but every 8th grade student took home a baby with permission from their parents, of course.
Yeah, I can attest to how realistic those baby dolls were because I had to do this. I remember this very vividly in the 8th grade. Yeah, I had a club volleyball tournament that particular weekend, so I very vividly remember that project. It was very impactful. We'll never forget it. So yeah, I can attest
Yeah.
to the effectiveness of that program for sure.
Yeah.
So let's shift gears a little bit, talking about your new role at the health district. So can you describe a little bit about your new role here?
Yeah, my new role has been an adjustment, of course, because I'm used to being in the public health nursing division, but I'm now still a part of leadership. I was the director of nursing before stepping into this position, so I'm still a part of leadership. I just don't really supervise anyone within the district, but much of my work in my current position is really behind the scenes and very supportive of leadership, staff, and it does eventually benefit the community. But my role is really intended to strengthen the infrastructure, the workforce, and cross-functional performance of the health district. I provide support for continuous quality improvement, professional development, and system-wide alignment to public health goals. So I serve as a key facilitator for workforce planning, policy development, including public health nursing policy, because a lot of those public health nursing policies, even in my 28 years and just stepping out of the position 1 year ago, have really changed. And that's been a result of a lot of things that happened in our communities and across the nation. And that's COVID, a pandemic. There's a lot of different policies and things that we need to still align with. I do quality improvement, accreditation readiness, program integration across all divisions. So, and additionally, I help to assess and address funding gaps. I support emergency preparedness efforts. I ensure public health services are delivered effectively and fairly across the community. So I think I look at everything across all divisions. So I'm not stuck in one division, but I work with all leaders, all directors in all the divisions to make sure that we're not only aligning within our different departments and divisions at the health district, but also are our programs aligning with the community and the things in our goals and strategic plans, not only at the community level, but at the state and national level. So it's kind of behind the scenes work. It's a little different for me. I'm used to being very community facing. I am some, but not as much as I was before. So it is a very different position.
So it sounds like what you're doing with the health district now is focused more on the big picture as far as what we offer as a whole and making sure all the programs are working together to meet the community's needs.
Yeah, that is correct.
So you mentioned a little bit about assessing the community's needs to make sure that the health district programs and services are meeting those. So how does your role integrate into that function?
So if I go back a little bit and look at my role, even as a director of nursing in 2016, we revamped a program called the Partners for a Healthier Ross County that had been operating since 1996. And one of the reasons that we wanted to revamp or re-energize this collaboration effort was to complete a community health assessment and community health improvement plan as a whole for the community. So essentially, the hospital, the health district, and the federally qualified health center, which in Ross County is Hopewell Health Center on Western Avenue, we as a group, we're all required to complete a community health assessment and a community health improvement plan for the community. The hospital and the federally qualified health centers do that every 3 years, and the health district every 5 years. So we decided to work together to create Ross County's first collaborative assessment and improvement plan. So in 2016, we went through the community health assessment. We brought together about 20 plus partners to help us achieve this goal. So that's kind of where we started with the CHAW and the CHIP. So the community health assessment is called a CHAW, and then the community health improvement plan is a CHIP. So what we did was we created a comprehensive community health assessment. We conducted that to provide a better understanding of our population health needs. We used a data-driven program called Mobilizing Action for Planning and Partnership, which is the MAP process. And that was developed by the CDC, the National Association of City and County Health Officials. And so we just went through this process that took an in-depth analysis of current community trends, the gaps, the resources, and the information was used to comprehensively evaluate the current state of health in Ross County and to prioritize those key public health issues. So while conducting the community health assessment, it just provided us a clearer focus on the needs without doing this in silos so that we could actually join forces with everyone else in the community. So while that brought that clearer focus, we still needed that community health improvement plan. And what that done is provided a long-term systematic effort to address the public health problems based on the results of that assessment through that process of community health improvement planning. We identified strengths, weaknesses, opportunities, threats, and we shared that vision and metrics for success with all of the groups and agencies and organizations that were a part of the program. And we made sure that our efforts aligned with those efforts of the state and at the federal level.
So when it comes to the community health assessment and the community health improvement plans and the health district's role once that data is collected, does RCHD have a more active role of meeting those needs, or do we play more of a data sharing role with the partners?
So both the CHA and the CHIP are intended to inform decision makers and funders about the challenges of Ross County faces in improving the community health and the priority areas where the support is most needed. So again, I'll go back to the community health assessment and community health improvement plan are a part of the Partners for a Healthy Ross County. So it is all of Ross County, all the agencies, all the partners coming together and saying, these are the needs. This is what was identified in the community health assessment. And then this is a plan we're going to put together. And then when we put together that plan, and again, the reason I say when we put together that plan will change every time we do a new assessment. The community health improvement plan takes a shift based on what the needs are at the time. So based on those needs at the time, we come together and we look at each organization. And the health district may not be the number one entity that should address a certain need. Mental health, I can say that. We're not mental health providers. We deal with things that, where mental health might be a social determinant of health, and we, deal in substance use and those type of things that may come with mental health, but we're not mental health providers. So if mental health comes as one of the issues, then we would look at who in the community can do that. We would bring together a group of people that specialize in that, and then they would meet that need on the community health improvement plan. So one of the things with the Partners for Healthy Ross County that I've been most proud of since 2016 is once they came together, it wasn't something just sitting on a shelf that wasn't really active. It's been a very living, breathing document that has been used by multiple organizations to guide their practice and what they should be providing. So we see a need. We write an improvement plan that says this is where we need to go. These are the goals over a 3-5 year period. And then we look at who can best fill that role. And sometimes it's multiple people, right? I mean, we might bring together 10 agencies that's working on one of the goals in the plan. So to answer your question, the health district is involved, very involved. In Partners for Healthy Ross County, I mean, we have multiple employees and staff who participate in different roles, and but they are not the health district is not responsible for the entire, making everything better, I guess, improving the whole community. It's a really group effort of a lot of agencies across the community.
Collaborative effort of all the different entities, but it sounds like the health district definitely helps raise awareness to those issues that come up on the assessment.
Absolutely.
Would you say that the health district tries to gear funding toward the initiatives that are on the CHA and the CHIP once we get that data?
Yeah, again, I can speak from 20 plus years ago when I called it chase the money. Health districts chase the money. So it didn't really matter what the need was, or maybe we didn't know the need, or maybe it was a national need and not a community need. It didn't matter. It's really what we decided the need was at the time. And to keep staff and that type of thing, we would start programs. Not that they weren't good programs. I'm certainly they were all good programs, whether that be physical fitness programs. I mean, I've worked in grants where we promote physical fitness, actually, with the walking path in Chillicothe, down by the park, et cetera. One of my first jobs, and that would have been in the late 90s, was to put signs on the walking path that like encouraged people. And they were marker signs to let you know that you had walked a certain amount, and then a little encouragement message to keep you going. So the programs were great. We promoted prevention of heart disease and those type of things. But I think over time, and especially since joining forces and no longer working in your little silos of you're here and you're going to fix all the problems, once we joined forces with other agencies and entities that had the expertise, the hospital, for example, access to care, those type of things, us going and trying to provide things in the schools, and now working through this process of access to care, which was in 2016, was one of the big priorities that came out of our community health assessment, was access to care, and trying to get access. And the school-based clinics, the mobile clinics that are now provided by Adina, and those type of things came out of the Partners for a Healthier Ross County. So I do believe that as a health district, we do look at the priorities and try to figure out where do we fit in that? And it may be as simple as education, right? It may not always be chasing the money. When we're talking about sexually transmitted disease case counts and that type of thing, it could be as simple as education that may not even require a lot of money, but just time and efforts of our staff to know that, that's something we need to address. But no, I don't think we chase the money like we used to. I think we really do look at the plans and the needs of the community, and that is how we then address those needs with our resources and any of the resources that we have.
You'd mentioned access to care. So were there certain populations that were being underserved?
I think access to care, and we just look at the social determinants of health, and we look at poverty, and we look at homelessness, but we also look at how rural and spread out our community is as far as distance. If you live distant in the community, you might not have a pharmacy close to you, or you may not have access to medical help, urgent care, et cetera. We've seen food deserts. Back then, there was a lot of food deserts when we first did this, and we've seen Dollar Generals, put into communities where there was no access, and they carry things like bread and milk and non-perishable items where people have access. So I think when we speak of access to care, it was more talking a lot to not only to the things of the social determinants of health, income, education, housing, all those things, but a lot speaking of the rurality of our community and how people live out, 30, 40 minutes away from any kind of access to any kind of care. So I think targeting schools is a great, way to provide that access, taking a mobile unit. The health district has a new mobile unit. And I know you guys have spoke about that before on a podcast, but we have a mobile unit that we can actually take out to our communities in these different districts and areas where they might not have access, and we can provide immunizations and those type of things that they need. So I think access to care overall in general, just looking at a lot of different things, a lot of the access to care that we have now came from the original community health assessment and community health improvement plan that was created through agency partners.
You'd mentioned that the Partners for Healthier Ross County was started in 1996. Have there been large shifts of the needs in our community as far as public health is concerned, or have they stayed consistent over those years that you've seen?
That is a really, really, really good question because I think if you look at the public's health, it's a very broad term. And I think one of the things in public health, the concerns are ever changing. Public health providers are really good at repositioning themselves and, you know, making changes at all levels, federal, state, and local, depending on the needs. So if I look from back then in 1996, sure, I mean, there was a lot of things such as access to care, right? But as we go through time, we put things in place
Hmm.
that then changes the need. Because again, when I talk about our clinics years ago at the health district, when we were addressing, women's health, we did prenatal care. We had women who were pregnant that came there and were seen by our doctors. ADHD, I mean, attention deficit disorder. I mean, that's something that's addressed in pediatric offices. But years ago, we had Dr. Ader, and he would come and he would address that with our clients. So it's access. Now there's access. Everyone can get Medicaid and those type of things. So they have access to insurance, and there's things that didn't exist. We did a lot of free services back in the day. I think there has been some changes that have been drastic, such as substance use disorder, those things, mental health, things that we did not see back then that we see now. And maybe it's just because, we're really assessing it, and we're assessing it good. We're trying to get information from people in the community instead of us being in the office making the decision of what they need. They're telling us what they need. So yes, there have been some big shifts, but I think we could also go back to the social determinants of health and everything we've done since I've worked there. Education, poverty, lack of insurance, those type of things have always been there on the grid.
Hmm.
But then you had your other things that took, different turns, like teen pregnancy, substance use disorder, those type of things have been big things that have came up. But you always have those social determinants of health that have stayed consistent, I do believe.
How important is it that people in the community take this survey, the community health assessment?
It is huge. It has been the hardest thing for us. We even like to assess after we've assessed. So when you do a big community health assessment, the greatest part about that is really to take those small pockets where there's a problem and then assess those as well in a smaller set. When we first started doing the assessments back in 2016, I don't know, we might have had a couple thousand people. It's very tilted towards women, though. So a lot of women will take it, men will not. So we had a lot, and that has fell off year after year, time after time that we do this. It's just, I think this year we may have reached 800. I'm not really sure. But in a community of 70,000, we really need more people to tell us what their needs are, because we're basing that, and our community health assessment is not only the survey, but man, the survey is a huge, very important part of the assessment, because we can look at national numbers, state numbers, data that we receive. We have some data. We have death data at the health district because we are responsible for the vital statistics and the death certificates. So we can pull out, cardiac disease, diabetes, those type of things when there's higher death levels. But there's really nothing like hearing from someone in the community, that person that may be homeless, that may live in poverty, that may have not completed an education, that may not have a job, all of those things, to really hear from them and start really directing our focus towards their needs specifically. I don't think there's anything greater than that. But we do our best. We try to put our surveys in, waiting rooms where people are sitting. We put it online, Facebook, when people are just mindlessly scrolling. We do all of that, and our numbers are not that great. And I get it. The surveys are always long. They take a long time, and I think people fear to give us information, that we would somehow track that information back to them. And, everything we do is totally anonymous, and we have no idea who answered what. But I do feel there's probably those things that keep people from participating.
Yeah, so it sounds like it's very important to emphasize to everyone that their responses help guide the health initiatives for the next 3 to 5 years in the county. So their feedback actually does make a difference with how the local agencies plan for the next 3 to 5 years for what they're going to be focusing on.
Absolutely. I mean, that's it.
So that's why it's really important that we try to reach all of the different populations so we're getting a wide variety of responses from different age groups, ethnic backgrounds, different work environments, all different types, all different walks of people, so we can get the best snapshot of what Ross County actually needs from what it sounds like.
Yes, that's correct.
So how is your role affected by the CHA and the CHIP here at the health district?
I think my role includes more facilitating and supporting our current programs, future programs, and any processes that I try to help them align the operations of those programs and make sure that, we've identified the public health priorities that were found in the CHA and CHIP and that those programs are aligning with those priorities. So again, people come and they want to work at the health district. We have some of the best staff, and they come and they get their grant or their program that they're doing, and they're just, serving and doing a great job. And sometimes it's hard for them to see their larger purpose in the community. I know that in the beginning, before I knew a lot about community health, I would write a program and I was very focused. Like I said, teen pregnancy, sexually transmitted diseases. When I wrote that grant, I wanted to make sure that, we lowered these rates and these young people had opportunities for success and et cetera, et cetera. And I was very driven in doing that, but I really didn't see how it really affects an entire community. It affects them in multiple ways. Just their future, their education, their employment, all of those things, the behaviors. So I think my job is just knowing the CHA and the CHIP and knowing and ensuring that the programs that we're doing in the health district, that staff know how they align to the larger community and not just to the individual or to that subgroup that they're working with.
In your opinion, what do you see as some of the Ross County Health District's most important roles in the community?
Oh, wow. There are really a lot. And I would say, if you looked at the health district, we have things that we have to do, right? We have to investigate infectious diseases. We have to take care of people that, have been exposed to tuberculosis. We have to, inspect restaurants, all of those things. Ohio Revised Code says that this is our role at the health district. And I think all the other things that we do are just a bonus to the health of our community and to the benefit of our community. I think the greatest thing that I have seen is the focus on the social determinants of health and the conditions of the people right where they're at, where they're living, working, playing, worshiping as they age, all of those things, and their quality of life in the community. So I think the health district does a great job at any of those extra programs that they have, really addressing those social determinants of health and really focusing on those things. And one of the programs that, we're seeing around the state and the nation is community health workers, something they've probably been around. We just didn't have a name for them. They weren't certified or anything, but people that actually live and work in the community, just being that person that is stepping alongside, because as nurses, we're here to fix and to do and all of these things, that a community health worker actually steps alongside a person and really walks them through, whether that's housing or different individual needs that they have, and helping just facilitate care or whatever they need. And I think that comes in a lot of different forms. Like I said, it may not always be the nurse, but we have certified community health workers.
Yeah, Sage Fout, she's our community health worker here at the Ross County Health District, and she does a great job working with her clients, trying to connect them to all the community resources and services that they need. So that's definitely great, highlighting the community health workers. So in your opinion, what are some of the more pressing issues in public health currently affecting our community?
Well, and that's we're looking through the community health assessment now, right? We just completed one and looking at, we'll be finalizing our community health improvement plan in the coming months. I think, nationally, state and definitely locally, we're hearing about all of these things that are now affecting people, not only the chronic diseases, which tend to stay there, but infectious diseases, that's a concern, as the most recent pandemic has caused, a lot of people to think differently about vaccinations and those things. I will always be a proponent of vaccinations. Again, 28 years of doing this, I have seen what vaccinations can do. So I will always support vaccinations because I can understand, some people and they have a choice and they need education. But, when you're starting to refuse vaccinations that have been around for 50 years, and we don't have these diseases like polio, et cetera, because of these vaccinations. And we're starting to see a rise in measles and those type of things that we never had to worry about as a result of safe vaccinations. So I think that is an issue or a concern, would be for me, especially in public health nursing. I think mental health is huge. I think the long-term effects of COVID is a concern. And, we don't know what those are, all of those things yet, but we have seen them over the years, different things. I think health equity or equity in general, is a concern, just to ensure that everyone has the ability to be their best, in their best health. I mean, everyone in the community has a stake in health. Poor health is costly. People trying to maintain employment, employers paying high rates for insurance, rates of absenteeism. Whole communities can suffer economic loss when citizens are ill. So just ensuring that everyone has access. But I'd say my top three are infectious diseases, mental health, and having equity in healthcare.
And all three of those things, we have programs here at the Health District, like you'd mentioned, that we try to help meet those needs, like with infectious diseases. You mentioned our vaccine programs. With mental health, we have our Adolescent Health Resiliency Grant, where we have a nurse who does trainings for community members who work with youth to learn how to be trusted adults to youth in the community. And also for adults, we have our community health worker, Sage Fout, who can help try to get people connected to resources in the community for mental health. And you'd mentioned equity, about how we have the Access to Care program to help connect individuals to the healthcare that they need. And it sounds like we are doing whatever we can here at the Health District to try to meet those concerns.
Yeah, I think the health district, has always been really good. Like I said, even in the older days when we made the decision about what was needed, I think we were pretty on point back then too. But I think as we've really dove into the community health assessment, the community health improvement plan, started involving everyone, coming together with the community, I think a lot of the programs and grants and things that we have are really on target with our current needs here in the community.
It sounds like your new role as organizational development specialist here at the Health District is definitely helping keep all of our programs here connected to all of the outside needs in the community, and also with our community partners, so we can maximize our efforts as a whole here. So we definitely appreciate all of your 20 years of knowledge and experience here at the Health District, and everything that you do to help us here today.
Thank you, Sarah.
Thanks so much to Ross County Health District Organizational Development Specialist Michelle Long for joining us today. Visit our website at rosscountyhealth.org for more information about our programs and services. Until next time, take care and share the health.